The following program is sponsored by Femsmart and features medical questions from viewers. Nothing within the program establishes doctor-patient confidentiality.
Hello and welcome to Ask the Doctor. I'm your host, Mike Berger. Joining us today is Dr. Charles Powell with Femsmart with news on how you can get rid of cellulite.
Thanks, Mike. Glad to be here.
Okay, well, you're probably familiar with Celulite. Some of you may not be familiar with Femsmart. Femsmart started off their clinical practice with hormone management and weight loss. The clinic then branched into smart lipo body contouring, and now they're offering Cellulaze, a treatment for cellulite that attacks at its very structure. Now, before Dr. Powell begins to answer some questions, I'll remind you we are live. If you have a question, please call the number that you see on the screen. It's 1-877-981-2211, or you can also email your questions to info@femsmart.com. Remember, we're not doing general medical today. We're talking about body sculpting. Now, let's talk about Cellulaze. You can give us a quick rundown, if you will, Dr. Powell, on the products and how it does treat cellulite.
Absolutely. Well, Mike, this is a technology that we've been waiting for well over a year. We were teased with it. We saw it introduced in Europe. We saw it get approved in Canada in September. And finally, January 31st, we've got the technology FDA approved here. We were the first clinic in the South to get the technology after FDA approval and have absolutely loved it. I'm not one to jump on new technologies. This is something that absolutely I like seeing things get out into the general public, and then we make the decision if it's something we want to get into.
Sure.
I knew this from the very beginning. When we first saw that somebody had finally developed a way to get to the true pathology of cellulite, absolutely amazing. There's lots of treatments that are out there, and I've never purchased or invested in any of them just simply because they aren't really what we do at Femsmart. We are at Femsmart and AndroSmart used to one-time treatments, get them done. If we need something else in the future, come back and see us. We don't like these maintenance therapies that require people to continue to come back. Cellulase is basically the answer to the question for cellulite that we have been looking for a long time. Basically, the cellulite that occurs basically because of little bands that occur under the skin. These little bands over time start to shorten, and as they do, they cause the dimpling effect that women are so worried about. Those little fibers, that's the key. Cellulase is the answer. Finally, a way to get down there and attack them. And Mike, when you're looking at a disease state that attacks over 85% of women over age 25.
Really, that high?
Unbelievably high.
Now, we have some pictures, and you've been talking about a little bit what it is. So let's take a look at these pictures, and you can explain exactly what we're looking at.
Yeah, I'd be glad to. Well, these pictures were originally from one of the physicians that did the FDA study, Dr. DiBernardo, a wonderful plastics guy up in New Jersey. If you take a look at them, you can clearly see the before shots of what women consider classically as cellulite, and it is.
Right.
On the right, you see the picture about 6 months afterwards, and you can see a definite improvement in the tightness of the skin. Now, this is using the Cellulaze procedure that was developed by Cynosure, in which case we've advanced our protocol a little bit beyond that. But even then, those results are pretty impressive for a one-time treatment that far out. Now, if you look at this picture, you can see a little bit of a darker skinned individual who is actually a year and a half out. Now, as it stands right now, Cellulaze has been approved for short-term treatment, but as you can see, the studies are underway for a long-term indication for this. And we even have studies, if you can see in the next picture, a year out.
This was only done once.
This was a one-time treatment, correct. And that one-time treatment offers continued improvement. Besides just cutting the fibers that are underneath the skin, we actually stimulate the skin, the fibroblasts, to produce more collagen. And that's why over a period of time you see continued improvement in this. In fact, when we originally went into this, we were told that the 6-week results may not be that impressive, and only to tell women to expect maybe a 60% improvement in the long run. We've seen far beyond that, even at 6 weeks.
That's fantastic. Now, we do have some phone calls. We want to get to them right away and answer your questions. So our first phone call is coming to us from, I think, Cindy. Yes, Cindy Cindy's in Frisco. And Cindy, what is your question?
Yes, I'd like to know how this procedure is different from others. I've tried different things and nothing has worked so far.
Great. That's a wonderful question, Cindy. And that's part of the main reason why we're putting this out there so much, is that we need women to understand that with technologies that they've been burnt with in the past and haven't gotten great results. This is absolutely something that you can do that has the results you've been looking for. All of the technologies to date have really focused on trying to treat through the skin, and by treating through the skin does not really allow for it to get to the true problem in cellulite, which are these fibers. Now, not to say the treatments to date have not seen some results, whether it be topical creams or the various other devices that treat externally, but typically they're short-lived and they require maintenance therapy to continue. We are actually in Cellulaze going underneath the skin, getting to the true pathology of these little fibers and cutting right through them and releasing them, thereby releasing these dimples that occur and then tightening and strengthening the skin over time for continued results.
So, Dr. Powell, it sounds like, or I was under the impression that cellulite is a problem of obesity, age, whatever. Not necessarily so. That's not correct.
Absolutely. I mean, that's a wonderful question and analysis, because we have seen women absolutely come in that are the tiniest, healthiest, work out, eat right, but they are devastated by this disease state of the skin, not a disease of obesity.
Interesting. I'm sure a lot of people just like me had no idea that was the case. Phone lines are open. If you aren't able to get through, please keep trying. Cynthia is with us from Kennedale. And Cynthia, what is your question?
How many treatments do I have to go through for the best results?
Again, a very common question, because up to date, so many things have required multiple treatments. With Cellulaze, we're talking about a one-time treatment, and that one-time treatment gets you these lasting results that we see in the pictures.
That is just, it's incredible. And we don't need to worry about coming back in 5 years or 10 years. It's just once and done is...
Well, that's a good question, Mike, and I cannot answer that yet. I mean, I can tell you that we've got some results that Cynosure has put out that are 2 years out, but the technology has only been on the face of the earth that long. So the long term, we can only do predictions on it this time, but we are seeing long-lasting results that are light years beyond anything that we've seen to date.
That's fabulous. We're going to take a short break, and we'll be right back answering more of your questions. I hope you're enjoying the show today. Very interesting. You can call us at 1-877-981-2211 or email your questions to info@femsmart.com. We'll be right back.